Hello everyone. Today I'm going to discuss about the chronic injury of sports system. So in this surgery topic, so what are the common sports related injuries such as the soft tissue injuries, especially Quervain'S tenosynovitis and also carpal tunnel syndrome. So here I'm going to discuss about the what is tenosynovitis, what are the causative factors, and what are the risk factors who are going to get the more prone to get this type of conditions, and also what are the signs and symptoms, special test for this tenosynovitis, what are the differential diagnosis, what is the medical management and also surgical management. So first I'm going to discuss about the tenosynovitis, also called as de Quervain's disease. So it is named after the Swiss surgeon, there is a Fritz de Quervain's, so who was first described in condition 1895. So who was first described about the condition about the tenosynovitis. So on his name, the surgeon, Swiss surgeons, so we called as the de Quervain's syndrome or de Quervain's disease or tenosynovitis. So it is a stenosing tenosynovitis which affects the tendon sheath of the first dorsal metacarpal, first dorsal compartment of the wrist. So first dorsal metacarpal means, so here is going first dorsal compartment means if you see in the wrist, total 6 components are there. So if you see the first, this is the dorsal, the first component is the thumb side. So towards the radius, so this radius styloid process. So here this part is going to be affected. So this is called the first dorsal compartment. So here the two muscles are going to, the two tendons are going to be inflamed, and the tendons, so is because of the stenosis, that's a narrowing will be happening. So because of the narrowing, the friction and also the irritation of the tendons, it may give the severe pain and also difficulty doing the ADLs. So it is characterized by the degeneration and also fibrosis of the tendon sheath. So the major symptoms in the tenosynovitis are going to be the first compartment is going to get the irritation and also because of the swelling and also inflammation. So it may chance to get the fibrosis. So after the inflammations, it will give the fibrosis. So because of the fibrosis, the sheath is going to get the thickenings. So it may gives the irritation on the first metacarpals of the thumb. So it gives the severe pain and numbness and tingling sensation. So if you see the incidence, so most commonly seen in the 30 years of age groups to 50 years of age group. And also it's most commonly affected for the women than the men, especially who are working in the household activities. So especially like a cooking and also washing clothes and also wringing clothes. So and also who are using the hands continuously. So especially the women are more chance to get this tenosynovitis. And also it is also commonly associated with the dominant hand, especially the dominant hand, the right side. So if they are who are working with the right hand prolonged time, or repeated injuries because of the prolonged time usage of the right hand, so may chance to get the right hand get the injury, or who are using like a dominant left side, so they will get the left hand injuries. So if you see the So coming to the anatomy of the wrist joint, if you see the wrist joint, here the 6 compartments are there. So according to the physician surgeons, so the majorly the first compartment is going to be involved in the first compartment. If you see in the 6 compartment is related is a thumb and also is the index finger and is going to be towards the middle finger, and is going to be see the fourth one is going to be the ring finger. So all together are going to be the 6 compartments are there. The first compartment, if you see the first compartment, abductor pollicis longus and also extensor pollicis brevis. So these two tendons are going to be involved in the first compartment. So these muscles are going to be, these tendons are going to be inflamed and also swelling, and also it may give the irritation, it leads to the severe pain. And also in the second and the third, in the second is going to get the extensor carpi radialis longus and also extensor carpi radialis brevis. In the third one is extensor pollicis and also extensor digitorum indicis. In the fifth one is going to be the extensor digiti minimi and also extensor carpi ulnaris in the sixth one. So these are the compartments. So in the each compartment are having these muscles are passing through these compartments. So if any compression or if any like a swelling or inflammations, so these according to the compartment, those muscles are going to get the inflamed and also getting the swelling as well as going to give the severe pain. So these muscles are going to be affected. So if you see the first dorsal compartment, so this first dorsal compartment is going to be extensor pollicis brevis, and also is abductor pollicis are going to be involved in the first dorsal compartment. So this is, if you see here, it is approximately 2 centimeters long, and also it's located over the radial styloid process. So in the proximal to the radiocarpal joints, exactly in the radius here styloid process. So it's going to be located at the first dorsal compartment. So what are the muscles are going to be involved? So these muscles are the abductor pollicis longus and extensor pollicis brevis. So if you see the origin of the abductor pollicis longus, so is originating is there in the ulna, that is the posterior surface of the ulna, and insertion in the base of the first metacarpals. So that is the reason. So if it is contract, it's going to be help to the abduction of the thumb, the main action of the abduction of the thumb. So it is innervated by the radial nerve. So if any inflammation, so it may lose the abduction of the thumb. So who are having the inflammation and swelling, they are unable to do the abduction movement. If they do abduction, is going to get the severe pain. And also next one is going to get the extensor pollicis brevis. So it's originating from the posterior surface of the body of the radius, and also distal to the origin of the abductor pollicis longus. So it's going to be here is going to be origination of the abductor pollicis longus. Just below this one is going to be in the radius. So it's going to get the extensor pollicis brevis. So this also going to be inserted in the proximal phalanx of the thumbs. So it's going to be both are inserted into the first metacarpal. So it's going to be the first metacarpals are going to be inserted. So that's why, so these two muscles are going to be involved in the de Quervain'S disease or tenosynovitis. So if you see the action of the extensor pollicis brevis, so if you see the pollicis means thumb, brevis means a small one, longus means a long. So it's going to be very long, and also abductor is going to be help in the abductor. Pollicis means the thumb and longus. So it mainly is help for the abduction of the thumb. So abduction and thumb, pollicis means thumb. So if you understand the name itself, we can understand the, so what is the muscle and also what is the action of the muscle, we can easily understand. Okay. And also this also is innervated by the radial nerve. Okay, coming to the predisposing factors. So these predisposing factors are, so especially who are going to prone to get this type of injuries, especially who are using like overuse injuries, especially who are using the hand prolonged time, especially in case of using the mouse, or maybe with the writing or staying in the typing activities, or maybe any like a chatting activities, or in case of if they are carrying any weights with the hands. So those people are going to get the like a de Quervain'S syndrome, or also called tenosynovitis. And also repeated tasks that involves in the overextension of the thumb and radial and ulnar deviation of the wrist. So who are doing the radial and ulnar deviation for a long time, and also especially the extension of the like a thumb in case of the arthritis, and also in pregnancy, especially in the pregnancy. So this tenosynovitis is most commonly seen in the women, especially in the pregnancy time. Tenosynovitis as well as the carpal tunnel syndrome. So because of the physiological changes in the pregnancy, the body weight also going to be increased, as well as they may chance to get the swelling in at the wrist joint. So because of the increasing the fluid accumulations in the wrist, so may chance to get the pressure, or may chance to get the swelling in the tendons, and also may chance to get the tenosynovitis as well as the carpal tunnel syndrome. So especially the activities such as the who are using the like a system with a mouse, who are using prolonged time, and also especially the typing activity in the chatting, or who are using the phone prolonged time. If you see the thumb, the position of the wrist are going to continuous is going to be the abduction positions, and also is the flexion positions. So it may gives the is a friction at the wrist joint. It may gives the tenosynovitis. And also using the long use of the computer mouse, and also use of the scissors and surgical tongs. So especially in case of the surgeons also, especially for surgeons also, they may chance to get, if they are using the scissors prolonged time or continuously, and also is the hair salon workers. So hairstylist, so those people are going to use continuously like this type of activities. And also maybe plumbers, or you are using the hammer prolonged time, or maybe you are like doing the like in professionally in knitters, so they are using to more hand works, so it may leads to the pain and also numbness and tingling sensation in the wrist. And one more thing, important thing is, if any mother carrying the baby prolonged time in these positions, or if they're playing with the baby, lifting the baby prolonged many times, so it may give the pain in the thumb regions. So that is the reasons. So this tenosynovitis are also this DIFFERENTIAL disease, also called as mother thumb disease or mother thumb tenosynovitis. So another name for this condition. So who are using that means who are playing with the baby prolonged time and also lifting the baby many times, so may chance to get the pain in the thumbs. So because of the always abduction position while carrying the baby, so it may give the pain. So that's the reasons it is called as mother's thumb. So here the main etiological factors are going to be, just now we discussed. So extensor pollicis brevis, and also is longus are going to be abductor pollicis longus are going to be involved. So because of these, tendons are going to be inflamed and also is going to get the swelling. So inflammation and swelling happen. So because of this inflammation and swelling, so it may give the severe pain at the first metacarpal, so also called as the thumb regions. So acute or repeated trauma is restraining the gliding of these tendons, results in the inflammations of the synovial sheath. The synovial sheath is going to be get the swelling and also inflammations. So it leads to the friction. So between these tendons and also synovial sheath. So because of the friction, it may gives the it may sliding. So it gives the severe pain in the thumb regions. So this inflammation gives the reactive fibrosis and also thickening of the sheath. So it may give the fibrosis may happen, as well as the sheath also going to be thickening. So it leads to the degeneration of the synovial sheath. So this extensor retinaculum is going to be get the degenerations. So in those conditions, it may give the severe pain and also unable to do the functional activities, and also the restriction of the all the movements may happen in the thumb. So that is the main pathological changes in the de Quervain'S syndrome, also in the tenosynovitis. So if you see the symptoms of the de Quervain'S disease, so the main symptoms is going to give the pain in the radial styloid process, especially in the radial side. So he's going to get the severe pain, and also this pain is going to be worsened during the movement in the radial deviation and also ulnar deviations and also extension of the wrist. So all the movements are going to be disturbed. So it leads to the functional activities going to be disturbed. So the tendon sheath may feel thick and also hard, and also tenderness is mostly acute the tip of the radial styloid process. So especially the tip of the radial process is going to be, if you palpate here, the tenderness, if you press it here, so is going to get the severe pain. And also pain aggravating on the grasping and also raising object with the wrist. So for example, if you hold any object, so if you have, for example, if you hold any tumbler of glass of water, or maybe if you are using any like a spoons, or while cooking, if you are using any like a mixing the food, anything with a spoon, or these radial movements and ulnar movements, so it may give the severe pain. And also how we are going to identify this type of problem, and also tenosynovitis. The simple test. So if you go to the X-rays and also any other test, also it won't give the clear informations. But simple special test is going to give the confirmation about the tenosynovitis. The simple test is called as Finkelstein's test. So in this Finkelstein test is nothing but we have to ask them to hold the thumb in the adduction positions, that is upon his positions, and also ask them to flex the fingers, that is making the fist. Then ask them to do the ulnar deviation. So this is going to be the downward. So if ulnar deviations, if any pain in the radial styloid process, so it indicates the positive Finkelstein's test. So who are having the pain in the wrist joint here, so here in the mid-prone positions, ask them to do the mid-prone positions, and also thumb flexion and also opponent's positions, ask them to flex the fingers, all the fingers, and also making the fist. So if you stabilize, so ask them to do the ulnar deviations. So that means they bring it down, push down, so it leads to the severe pain here. So it indicates that is a positive test for the tenosynovitis. So this test is called as is a Finkelstein test. And also, so many other causative factors or so many other conditions also may chance to get the pain in the wrist joint and also especially in the radial styloid process. But how to differentiate the tenosynovitis, that is the Quervain'S disease, and also other conditions? Because of we cannot find easily with other tests, but only with a simple test we are going to identify. So what are the other types of the disease may chance to get the pain in the thumb region and also wrist region? So especially if anybody having the carpometacarpal arthritis of the thumbs. So if anybody having the arthritis, so also same, they're going to get the pain in the thumb as well as is going to get the crepitus. Crepitus means if you do the movement, is going to give the crack sound. So if the sounds of the crepitus are going to be present who are having in the like arthritis. So that is called the crack and grind test. So if you do the like a movement, so it's going to give the crack movements, and also we are going to feel the like a grinding, how we are going to feel the sensation, all we are going to feel the in the crack and grinding test. In case of any scaphoid fracture also, so may chance to get the because of the bone is there in the scaphoid. So if you see in the carpal bones, 8 carpal bones are there in the 2 rows in the carpal bones. So the first one is if anybody having the injury or fracture in the scaphoid bone, also may chance to get the pain in the same in the radial styloid process, and also is going to in the anatomical snuff box. Anatomical snuff box means, so this if you hold or if you are extension of the thumb, so we are going to get the here we can feel the some depression here, some space here. So this is like a snuff box, anatomical snuff box. In the ancient days, so most of the people are going to use some drugs or maybe some medicines or something. They're going to inhale like a snuffing through they're going to put some the powder material for inhalations. They're going to put at the wrist joint in the snuff. So here the snuff box, we are going to get some depression here. We feel the space here. So this is going to be anatomical snuff box. So they're going to use to snuff it here. So there they're going to feel. So that's why it is called the anatomical snuff box. And also who are having the snuffers fractures or any fractures around the wrist joints, and also insertional intersection syndrome tenosynovitis. That is the second dorsal compartment involving the tendons. So which is the extensor carpi radialis brevis and also extensor carpi radialis longus. So these two muscles also affect to the second compartment. Just now we discussed all the 6 compartments are there. So if anybody get the second compartment also may chance to get the pain in the thumb regions. And also we have to, another one is if anybody having the extensor pollicis longus tendinitis. So if the tendon is inflammation, if any swelling, any injury related to, in case of any rheumatoid arthritis, any direct injury, or in case of the distal radius fracture, so may chance to get the pain in the wrist joint. But only thing is how we can differentiate the tenosynovitis of the that is the Quervain'S disease, or maybe other conditions. Only we have to do the special test, that is a Frankenstein's test. So with this one, we are going to easily differentially diagnose the conditions. So that is about the differential diagnosis. So what is the treatment plan? So the treatment plan is main the treatment, the aim of the goal of the treatment is restoration of the normal, painless use of the involved hand. Only thing is we have to bring back them into the normal hand. So that is the normal hand. So, and also painless use of the involved hand. So if they hold any object, if they use the hand while cooking and also while wrenching the like a cloth. So sometimes if they're wrenching the clothes, or maybe if the squeezing any dough or anything or any like a squeezing activity, so it may use the severe pain in the thumb regions. So we have to bring back, so without like a less painless activities. So, and also resolution of the inflammation process, prevention of the recurrence through the educations, and restoration of the pain-free movements and also strength. So we have our goals are so we have to reduce the inflammations through the conservative management as well as the medical conservative management. We are going to use some like a heating modalities and icing modalities, especially the physiotherapy techniques, also ultrasound therapy. So different techniques are going to use to control the swelling, so inflammations, and also prevention recurrence of through educations. We have to educate properly. So which activities are going to be worsen the pain, or which activities are going to be lessen the pain. So how to minimize the friction between the tendons in between the synovial sheath and also tendons. So we have to educate properly. So which activities should avoid and which activities will give the easiness to the movement. So these things, if you explain to the patients, so we can prevent the severe complications. And also how we are going to modify our with the wrist activities instead of using the mouse. So we can modify the different type of the mouse, or with the grip size if we have to alter, who are using the like a spoons and also any like a cooking materials. So that time we are going to use the different type of the holding like activities. We have to modify the all the activities according to the symptoms. And also restoration of the pain-free movements. So if any painful movements, so we have to restore the with the strengthening and also with the pain-free movements. If any movement restrictions, we have to give the like a active ROM exercise in the within the painful limits. So if the swelling occurs, so we have to give the like a painkillers and non-steroidal anti-inflammatory drugs, or sometimes we have to give the non-steroidal and also steroids also. So this medical management, if it is not controlled with the conservative managements such as the ice therapy, so if you give the ice applications at least 3 to 4 times a week, so and also every day at least 2 to 3 times, so it can reduce the swelling in the tendons, and also we can prevent the friction between the synovial sheath as well as in the tendons. So that also conservative management. And also some other immobilization techniques with the physiotherapy techniques. So these are going to be the splints are going to be to prevent the that means accessory movements, or maybe to prevent the some painful movements. So these splints are going to reduce the swelling as well as reduce the inflammations, so we can use. So if it is not controllable, so in the medical management can go with the corticosteroid injections. So these can be given to the patients with a moderate to marked pain with the symptoms lasting for the more than 3 weeks. So if anybody get the more than 3 weeks, so we can give the corticosteroid injections, which will reduce the inflammation as well as the swelling, and also helpful to reduce the pain. And also non-steroidal anti-inflammatory drugs such as the ibuprofen, and also so these are going to be some diclofenac and sodium. So these medications are aceclofenac. So this type of medications are going to be reduce the inflammations and also reduce the pain levels. So these are just now we discuss about the splints, and also ice applications are going to give the best results. So and also the proper exercises, physiotherapy management. So this actually is the special treatment area. So this the first we have to do the assessment. So which muscles are affected, and also which muscles have a weakness and other muscles are tightness. So we have to balance it with the exercise therapy and also strengthening exercise. So in case of the swelling, so we can advise ultrasound therapy with a pulsed mode is a 3 megahertz, at least minimum 5 minutes to 10 minutes. And also another treatment method is, so this is the physiotherapy techniques, so ultrasound therapies. So these ultrasonic waves, the sound waves are going to is helpful to reduce the swelling as well as reduce the pain. And also another treatment with phonophorosis. Phonophorosis means is along the nothing but is the ultrasound therapy along with the hydrocortisone, that is a steroid. So these are going to give the like a cream based. So this cream is going to be used in the ultrasound therapy. So we are going to put the ultrasound over the inflammatory area, and if we apply the ultrasound, the sonic waves are entering into the tissues. So these sonic waves are going to be helpful to reduce the swelling. And also gentle active and also passive motions of the thumb and also wrist encouraged for the 5 minutes every 1 hour to prevent the joint contractures and also adhesion formations. So these things, so every 5 minutes while you are working on the system with like a mouse, or is continuously using the any like a typing, or maybe like any charting on the phone. So and also if they're carrying the baby, and these knitting people, so who are more prone to get this disease. So if they do 5 minutes every 1 hour, so we can prevent the adhesion formations and also contractions. And also another important thing is strengthening and also stretching exercise after the initial pain subsides. So during the pain time, so better we can avoid the stretching, sustained stretching may use the severe pain also. So after the Swelling, after the swelling reductions or if they reduce, so then we can start the strengthening as well as the stretching exercise. Depends upon the weak muscles and depends upon the overactive muscles. So for the overactive muscles, or we can give the stretchings, and also which are muscles are the weak, for those muscles we have to strengthen. So this is about the Quervain'S disease. So these are the some exercises to prevent the adhesion formations and also strengthening to the wrist muscles, especially. So these grip exercises are going to be helpful, and also these finger springings. So they are going to use the rubber bands to strengthen the finger extensors and also abductors and are going to opponents. So these muscles are going to be helpful. These exercises are going to be helpful to prevent the Quervain'S disease and also to control the pain and swelling. And also if you see this opponent stretchings also helpful, also wrist flexion extension, and also we have to give the strengthening exercise with the wrist flexions with a small dumbbell, ask them to hold the dumbbell and do the wrist flexion extension. While during any these exercises, if they're having any severe pain, ask them to stop immediately. So that is the treatment for the Quervain'S tenosynovitis. But in case of if it is not controlled symptoms with like a hydrocortisone or maybe corticosteroids and also non-steroidal anti-inflammatory drugs and physiotherapy treatments, if there is no improvement, so go for the surgical procedures. So that is called as the decompression surgeries. So if you see here, so this is the retinaculum, so synovial sheath. So there is going to get the fibrosis and also these two tendons are going to get the swelling. So when it's going to be indicated, so if the pains are the persistent, so if it's not controllable, the pain continuously, so if the symptoms are not subside, or if not like a less symptoms, if not getting the recovery, so in those conditions, so indication for the surgical procedures. So if symptoms fail to improve or recur after 2 corticosteroid injections, so after the 2 sessions of the corticosteroid injections, so if there is no improvement, if there is no pain reductions, so they can indicated for the surgical procedures. So we can refer for the surgery. So the surgery is usually performed in the outpatient setting. So it is an entire like a local, regional or general anesthesia. So can go with is a outpatient, is a very small surgeries. So and also in case of the limitations in the ADLs due to the pain, so any abnormals in the movements in the wrist joints are unable to do. So in those people are referred to the surgical procedures. The goal of the surgery is to open the dorsal compartment and covering to make more room for the irritated tendons. So if they remove here, so that means if you remove the like in the surgical procedures, so it's going to be less the irritation between the tendons and also sheath. So because of the relieving these tension between the tendons and sheaths are going to release the pain. So it's going to create the more room for the tendons. So it reduces the pain and swelling. So this opening allows the pressure relief of the tendons to ultimately restore the free tendon gliding. So then the tendons are going to be free movement and also it glide very easily. So that time the patient won't get any symptoms. So if you see how the Quervain'S decompression surgeries, so during the procedure, the patient will generally lie on the back. So with the arm outside, the surgeons will apply the tourniquet at the patient arm. So he's going to, while supine lying position, the patient's hand is going to be at the sides, and also this one is going to be give the local anesthesia. So at one particular regions, at the wrist regions, and also above the wrist and also below the wrist. So here they are going to the local anesthesia, and also is the segmental is one part is going to be forearm, below the forearm they are going to give the anesthesia. So after the patient positionings, so after sterilization hand and wrist injections at the numb of the wrist, so thereafter giving the injection, the wrist and hand is going to get the numb at the surgical area. So the patient remains, everything is going to be awake, and general anesthesia is rarely used for this procedure. So most probably they're going to use we have to use like a local anesthesia to, and that means that time the patient is going to be awake and they know what is going for the surgeon is doing for the Quervain'S disease. So after the area has been numbed, the surgeon make a small incision at the base of the thumb. So he's going to get the horizontal incision is going to do at the base of the thumb and locate the band fascia. so that runs across the top of the tendons. So sections are retinaculum. So they are going to insert is going to do the radial styloid process is going to do the horizontal incisions. So opening the incision area, and also they find the extensor retinaculum. So how to release the fibrous sheath here. So it's going to be see here. So this is going to release. So if it release, the space is going to be increased for the tendons. Some surgeons also perform this procedure endoscopically using the small incisions and also endoscope to view the surgical area. So instead of the open surgeries, so some surgeons depends upon the surgeon decision, they're going to do the endoscopy. That means they're going to insert the small tube. So the flexible tube with the camera, so is going to insert into the tendon regions, is going to resect the fibrous tissue. And also surgeons release the extensor retinaculum by serving it and taking care not to damage the tendons is underneathing or near the radial nerve. So here the major nerve is supplying towards all these muscles, radial nerve. So while doing a surgery, so have to avoid the injury to the radial nerve and also underneath the other structures. And coming to the surgical instruments are removed and also incision is closed with the stitches. The surgical site is then bandaged. So after resecting cutting the fibrous sheath. So after that is going to close the incision area and also application of the bandage. So after a brief recovery period, the patient will go free to go home and also the same day as the surgery. So this is a small minor surgery. So they can go to the home is on the same surgery because of the minor surgery, only releasing the fibrous tissue. So that is about the one type of the sports injuries. So these sports injuries means commonly seen the who are playing with the sports and also who are doing the activities. So that's why this is soft tissue injuries. So we can prevent with the proper exercises, proper ergonomics. So after the surgical procedures also, we have to advise and also proper ergonomics. So this is going to be the different type of mouse. So we have to avoid the prolonged use of the another type, the normal regular type of the mouse. So we have to use this is the ergonomic mouse. So it features a molded thumb. Rest support will be, so if you see a thumb is in the resting positions. In the normal mouse is going to be, it won't provide the resting for the thumb. So this type of the ergonomics modifications and using the other modalities are the tools, so we can prevent the further complications. And also some other modifications with the hand activities, we have to use the power grips. So all the fingers and the loose grip instead of the using a pinch. So sometimes using a pinch activities, so we have to use the power grip. So if they use the power grip, so the muscles are going to be in the same positions, it won't get irritation in the tendon regions. Minimize the repetition and also rest time occasionally during the repetitive activity or slow down activity. So if anybody working with the hands continuously, so give 5 minutes break in between every 1 hour. So at least that time if you do some stretching exercise and also some activities with the fingers and fist makings and also some stretch for the flexion and also extension, some strengthening exercise, ulnar deviation and radial deviation. So it is going to give the friction movement on the tendons, so we can prevent the further complications. Another one, use a light grip on the tools, pens and mouse. So instead of using the heavyweight one, use the light objects. So and also alternate hand during the activities if it's possible. So if it's if it's painful or if any strain, use the other hand for the other activities. So the activity modifications and also tool modifications will prevent the complications such as the tenosynovitis.